What's up, veterans? VA Disability Guy here, back again with another video that you don't want to miss, especially if you're a Vietnam era veteran or was exposed to Agent Orange. Today's video is about coronary artery disease, and though it is one of the top 20 most commonly claimed VA disabilities amongst veterans, it is only one heart related disability that veterans claim. So before I even get started with the video, if you want me to do another video of other heart conditions that can be claimed by veterans for disability, let me know in the comments. And if you want me to do a follow-up video to this one where I explain secondary conditions connected to coronary artery disease, let me know in the comments as well. Now, today, in this video, we're going to talk about, as I have said already, coronary artery disease, also known as CAD. And we're going to talk about what it is, some of the symptoms, what causes it, of course, the VA disability rating, and of course, like I said, for my Vietnam era veterans, I'll leave a little something special for you because this video might really help you all out. So before we get into today's content, if you find this video useful, hit the thumbs up, leave a like on the video, and if you're new to the channel, go ahead and subscribe and hit the notification bell. That way, whenever I upload videos like this one, you'll be notified. Interacting with the channel in these ways lets the YouTube algorithm know that these videos are important, and it'll push these videos out to other veterans like yourself. So without further wait, let's get into today's video on coronary artery disease. All right, so coronary artery disease, what is it? For those of you that don't know, coronary artery disease, also called CAD, is the most common type of heart disease in the United States, and it's sometimes called coronary heart disease or ischemic heart disease. And I might be butchering these words, so just work with me. Okay, and for some people the first sign is going to be a heart attack, so that's one of the first signs. As far as the cause of this disease, it's caused by plaque buildup in the walls of the arteries that supply blood to the heart, called the coronary arteries. Now, when it comes to symptoms of coronary artery disease, angina or chest pain and discomfort is the most common symptom. All right, angina can happen when too much plaque builds up inside your arteries, causing them to narrow. And narrowed arteries can cause chest pain because they can block blood flow to your heart muscle and the rest of your body. So, as far as the actual symptoms of this disease, is going to be chest pain or discomfort, aka angina, weakness, lightheadedness, nausea, feeling sick to your stomach or a cold sweat, pain or discomfort in the arms or shoulder, and shortness of breath. And over time, it can weaken your heart muscles. Okay, and that could lead to heart failure, which we'll probably talk about more in detail in this video or maybe another video. Before I get to speaking about the actual VA disability ratings for coronary artery disease, I want to talk to any vets that were exposed to Agent Orange. Okay, something you need to know is Agent Orange exposure has opened the doors for you all to claim quite a few presumptive disabilities. And what that basically means is if you have a DD-214, which was your separation document or retirement document, and it shows that you were at a certain location where you were presumed to be exposed, then you may file a claim for certain disabilities. This is one of them. All right. So do your own research. And if you want me to make a video on a list of different presumptive disabilities just to do with Agent Orange, let me know in the comments. Now, let's go ahead and get to the actual disability ratings for coronary artery disease. All right, now before we get into the rating, we have to talk about what doctors use to determine whether or not you have coronary artery disease. They're going to do what's called a METS test. And what this test does, it's an evaluation, or it's usually called a stress test, basically. So what they do is they will have you exercise either on a treadmill or exercise bike or something like that. And they'll determine if your coronary arteries that move your blood to and from the heart are blocked by plaques or fatty deposits. And what they're looking for is a 70% or more blockage. Okay, the METS test also assesses how well your heart is functioning and getting oxygen. But generally it does take additional testing to confirm you have coronary artery disease. Now, when it comes to the VA specifically, what they're looking for, of course, it's going to be determined by your METS test. But for a 10% rating, your condition score or your METS test is 8, 9, or 10 on the test while causing shortness of breath, and notice the symptoms: shortness of breath, fatigue, chest pain, and dizziness, or you have the need for continuous medication. Okay, so either you need continuous medication for this issue, or your METS test is an 8, 9, 10 and has those symptoms. For a 30% rating, your condition score must be 6 or 7 METs on the METS test while causing shortness of breath, fatigue, chest pain, and dizziness, or there is evidence of hypertrophy, which is thickening of the heart muscle, or dilation, which is an expanding of the heart. For a 60% rating, you have to have experienced at least 2 episodes of congestive heart failure in the past year, or your condition scores are 4 or 5 MET on the METS test while causing shortness of breath, fatigue, chest pain, and dizziness, or you have a third, your left ventricular dysfunction is causing an ejection rate between 30 to 50%. And for a 100% rating, there is a continuous congestive heart failure, or your condition scores 3 METs or less on the MET test while causing shortness of breath, fatigue, chest pain, and dizziness, or the left ventricle is found to be pushing out less than 30% of the blood it is meant to with each beat. So your heart is functioning at less than 30%. All right, ladies and gentlemen, that's going to do it for this video on coronary artery disease. Now, if you found this video useful, once again, hit the thumbs up, leave a like on it, and if you haven't subscribed to the channel, subscribe and hit the notification bell so that the YouTube algorithm pushes this video to more veterans like yourself. And remember, this was only one of the heart conditions that can be rated by the VA. So if you want me to do a video on other heart conditions, let me know in the comments. And if you want me to do a video on secondary conditions related to this particular disability, let me know in the comments. I'll leave some videos up here for you to check out just in case you're interested. And as always, take care of yourself, take care of those around you, and I'll catch you all in the next video. Peace.